Hello everyone, welcome back. So in this video we will solve questions of chapter 5 Dento-Osseous structures and TMJ of the subject oral anatomy from Dental Pulse. So let's begin. There are 25 questions in this chapter, so we will solve all the 25 questions. So let's begin. Question 1. Basically TMJ is a ball and socket joint, hinge and axis joint, synovial joint or diarthrodal joint. So its answer is diarthrodal joint. TMJ is an example of diarthrosis and its movement are in combination of gliding, that is translation movements, and hinge, that is rotation movement. Okay, so TMJ is a diarthrodal joint. Question 2. Temporomandibular ligament is attached to. So its answer is lateral aspect of TMJ. Temporomandibular ligament is attached to lateral aspect of TMJ. Now let's see its explanation. Capsular ligament completely surrounds the condyle. Temporomandibular ligament, this is the external or lateral portion of the capsular ligament which is attached to the zygomatic process of the temporal bone above and lateral posterior margin of the neck of the condyle below. Sphenomandibular ligament, it has attached above to the sphenoid bone and below to lingula of mandible on medial side. Stylomandibular ligament, it extends from the styloid process to the posterior border of the ramus of the mandible just above the angle. Temporomandibular ligament act as suspensory ligament during moderate mouth opening movements called hinge movements where forward movement of the condyle is very slight. Sphenomandibular ligament act as a suspensory ligament during wider opening movements where the condyle moves forward rapidly. So this was the explanation. Now question 3. Which of the following muscles moves the condyle and articular disc anterior and downward on glenoid fossa? So its answer is lateral pterygoid. Lateral pterygoid originates on the outer surface of the lateral pterygoid plate and greater wing of sphenoid. It inserts on the anterior surface of the neck of condyle and articular disc. Lateral pterygoid is anatomically suited for protraction, depression and contralateral abduction. That is, for example, contraction of right lateral pterygoid causes movement of the mandible towards left. Lateral pterygoid assists in translation of condyle downward, forward and contralaterally during jaw opening. Now question 4. Forward movement of mandible is done by. So its answer is option A, lateral pterygoid. Fine. Now mandibular closing or elevators are masseter, temporalis and medial pterygoid muscle. Mandibular opening or depressors are lateral pterygoid, suprahyoid muscles, that is digastric, mylohyoid and geniohyoid muscles. Retrusion is done by posterior fibers of temporalis, protrusion by lateral and medial pterygoid. Lateral movements are done by combined action of elevators and retruders on working side and protruders on non-working side. Okay, so forward movement of mandible is done by lateral pterygoid. Question 5. Position and movement of articular disc of TMJ is controlled by fibers of. So its answer is option D, upper head of lateral pterygoid muscle. Position and movement of articular disc of TMJ is controlled by fibers of upper head of lateral pterygoid muscle. Question 6. Which muscle is responsible for translation of condyle? So its answer is option D, lateral pterygoid. Now question 7. Thinnest labial plate is found in the region of. So its answer is B, lower central incisors. In the region of lower central incisors, thinnest labial plate is found. Okay, question 8. In which of the following areas is the alveolar process the thinnest? So its answer is B, buccal to the mandibular central incisors. Okay, now question 9. Which of the following movements are involved in the opening of the mouth? Option A, only hinge, that is rotation. B, only translation. Option C, hinge followed by translation. Option D, translation followed by hinge. So its answer is option C, hinge followed by translation. The opening movement of the jaws is a combination of hinge movement and a sliding or translation movement. In the first phase of opening, there is hinge movement rotatory around a transverse axis passing through the center of condyles. In the second phase, the condyle moves downward and forward along the posterior slope of the articular tubercle. There is gliding movement and hinge action combined. The disc moves along with the condyles. Okay. So the answer is hinge followed by translation. Question 10. Articular disc of TMJ is made up of. So its answer is option B, fibrocartilage. Articular disc or meniscus is composed of dense fibrous connective tissue and is located between the condylar head and mandibular fossa. The disc is biconcave in shape and divides the joint cavity into upper and lower joint spaces. The central area of the disc is relatively avascular, devoid of nerves, and has limited reparative ability. The disc is thick anteroposteriorly and thin centrally. Okay. Question 11. All of the following muscles are elevators of the mandible except. So its answer is digastric. Okay. Digastric is not an elevator muscle. Now question 12. Articular disc of TMJ is thickest posteriorly, narrow in the center, strengthened by lateral pterygoid, or all of the above. So its answer is all of the above. Articular disc of TMJ is thickest posteriorly, narrow in the center, and strengthened by lateral pterygoid. Question 13. Which of the following muscle helps in depressing the mandible? So its answer is option C, lateral pterygoid. Lateral pterygoid helps in depressing the mandible. Question 14. The zygomatic bone does not articulate with. So its answer is nasal bone. Option C. Zygomatic bone does not articulate with nasal bone. Question 15. The side towards which mandible moves is called. So options are tooth contact side, balancing side, working side, or non-working side. So its answer is option C, working side. During lateral movements, the side to which the mandible moves is called the working or functional side, and the side opposite to which the mandible moves is called the balancing side. Okay. Now question 16. Which of the following is not a structural element of the temporomandibular joint? So options are sigmoid notch, articular disc, capsular ligament, or joint cavities. So its answer is sigmoid notch. Sigmoid notch or mandibular notch forms the sharp upper border of the ramus between the condyle and the coronoid process. So sigmoid notch, it's not the structural element of temporomandibular joint. Question 17. Articular disc of TMJ receives insertion from which muscle? So its answer is lateral pterygoid. Option B. Articular disc of TMJ receives insertion from the upper head of lateral pterygoid muscle. Question 18. On opening the mouth, if the jaw deviates to the right side, it indicates the paralysis of right lateral pterygoid, left lateral pterygoid, right medial pterygoid, or left medial pterygoid. So its answer is option A, right lateral pterygoid. Now question 19. Which of the following movements are performed by a non-working condyle? Straightward. Option B, downwards, forward, and lateral. Option C, downwards, forward, and medial. Option D, downwards, backward, and medial. So its answer is option C, downwards, forwards, and medial. Now question 20. Depression of mandible is achieved by. So its answer is, its options are digastric, lateral pterygoid, geniohyoid, or all of the above. So its answer is Option D, all of the above. Now question 21. Retrusion of mandible is achieved by lateral pterygoid, temporalis, masseter, or none of the above. So its answer is temporalis. Question 22. Lateral movement of condyle is caused by. So its answer is both lateral and medial pterygoid muscle. Question 23. The premolar alveoli are what shape in cross section? Rectangular, triangular, kidney shaped, or oval? So its answer is option C, kidney shaped. Incisors have triangular shape of alveolus, canines have oval shape of alveolus, premolars kidney shape, and molars 3 distinct alveoli. Okay, now question 24. Which is the predominant factor in the formation of alveolar process? A. Eruption of teeth. B. Normal process of growth. C. Lengthening of condyle. D. Overall growth of the bodies of the maxilla and mandible. So its answer is option A, eruption of teeth. Question 5. Which of the portions of intra-articular disc is the thinnest? So options are anterior, B. intermediate, C. posterior, or D. retrodiscal. So its answer is option B, intermediate. The interarticular disc or meniscus is a fibrous tissue and is divided into 3 parts, that is thicker anterior section called anterior band, middle thinnest intermediate zone, thickest posterior section called posterior band. So we have done all the 25 questions from this chapter, that is Dento-Osseous structures and TMJ. So if you like this video, do like and subscribe to this channel. Thank you so much.